What happens after oocyte retrieval in IVF procedures? Have you ever wondered what really happens after the oocyte retrieval step in vitro fertilization? This crucial stage sets the foundation for the journey toward pregnancy. Let's break it down step by step. First, after the egg retrieval, which is a minor surgical procedure done under sedation, patients often feel mild cramping or a sensation of fullness. This is normal and usually goes away within a few days. It's important to rest and watch for any signs of complications, such as bleeding or infection. Next, the retrieved eggs are placed in a special laboratory environment to keep them healthy. The fertilization process begins soon after. This can happen in two ways. In conventional insemination, eggs and sperm are mixed together in a dish. Alternatively, in intracytoplasmic sperm injection, a single sperm is injected directly into each mature egg. This method is particularly useful for cases of male infertility, as it enhances the chances of fertilization. Once fertilization occurs, the fertilized eggs, now called embryos, are monitored closely for the next 3 to 5 days. During this time, they divide and develop, aiming to reach the blastocyst stage. This stage is crucial as it indicates the health of the embryo and its potential for implantation. Typically, about half of the fertilized eggs will reach this important stage. After monitoring, the best quality embryos are selected for transfer into the uterus. This selection process is vital and depends on the embryo's development and appearance. Before the transfer, the patient may receive hormonal treatment to prepare the uterine lining, creating the best environment for implantation. Selected embryos can either be transferred fresh into the uterus or frozen for later use. Freezing embryos gives patients more flexibility and can be especially helpful for those with conditions like endometriosis, where timing might be critical for success. Finally, after the embryo transfer, patients are closely monitored for signs of implantation and pregnancy. This is usually done through blood tests that check hormone levels. Emotional support and counseling are often recommended, as the IVF process can be physically and emotionally taxing. In summary, after oocyte retrieval, the focus shifts to fertilization, embryo development, and preparing for transfer. Each step is tailored to maximize the chances of a successful pregnancy, taking into account the unique circumstances of each patient. Always consult healthcare professionals for personalized advice and support throughout this journey.